All right, let's get going. I always hate to interrupt exciting, productive conversations occurring between people who care about primary care. So hopefully we will have many opportunities as this afternoon wears on to continue those dialogues together and remind ourselves that we're in a room full of people today that share our values. I am Mark Del Monte. I'm the CEO of the American Academy of Pediatrics and chair of the board of directors of the Primary Care Collaborative. And it's my extreme honor and pleasure to welcome you to this summit. It is a tradition now for many years that we gather right at the center of the holidays to refocus in the midst of everything else. To refocus our commitment to primary care and to remind ourselves how many stakeholders across many sectors care about the cause of primary care. And I think that that is typified by the theme for this summit, which is keeping people primary, building trust, and better health. And I hope that many of you were at the awesome Hill briefing that we had this morning. Raise your hand if you got to come up and see that. It was worth the trip just to see Senator Whitehouse tell some truths to us and put down some challenges for our community to engage in. I think it was a wonderful kickoff to the work that we're doing, and the combination of patient stories and exciting, dynamic, innovative primary care that is being provided across many settings was a great way to start this event. And so you are now in, I'm terrible with sports analogies, but I think we're in the second game of a triple header. Is that correct? So there was thank you, Ann. There was the briefing this morning. We'll have the summit today and then a marvelous celebration dinner tonight. So I hope that you can stay with us for that. As we sit here today, and starting this summit, the board of directors has been meeting now for a year to really think about the strategic direction of the Primary Care Collaborative and to gather all of the evidence that PCC gathers up and produces and disseminates, and to look at our goal from all the lenses that members of the board of directors brings to that discussion. And after a year of hard work to really think about that, what we have come up with, I think, is a very focused goal, a clear and compelling big idea about primary care. That in order to create population health and to improve health equity, we have got to change the way that we are investing in primary care, and we have to invest in effective payment and delivery models for all populations. It's a simple but compelling focus of the collaborative, and we'll be chasing this as hard as we can over the next couple of years. It also is a validation and an elevation of our Better Health Now campaign. We have been trying to communicate with policymakers and opinion leaders and everyone else who cares about what we care about, that we have got to change the way that we think about primary care in the nation's capital, here, Washington, D.C., and all of the policymakers here, but also everywhere else. And that there are extraordinary things happening in communities all across the country that we need to go find, we need to lift up, and we need to scale. And so part of Better Health Now is telling that story and lifting up people who are doing exciting things. So the structure of today, I will stop talking very shortly and introduce Ann Greiner, our president and CEO of the Primary Care Collaborative. We'll have a panel discussion grounding our work together on what's at stake for patients and having access to high quality primary care, and how we also need to simultaneously support clinicians so that they can provide that care. Then we'll have a second panel about how public and private leaders are responding to the challenges that lack of access to primary care creates, and how to translate those for individuals, families, and communities. And this is not an afternoon where you're going to be listening to amazing experts only. In the middle of the afternoon, we're going to get to work, and we're going to have some tabletop engaging exercises to help us elevate together what we can do as a community to improve the nation's health and advocate for our cause of primary care with our own stories, our own data, and the evidence for our communities. And then we'll have a great closing keynote address, a fireside chat between our board member, Peter Long of California, and Mayor Ingraham from East Point, Georgia, to talk about what is at stake in communities who do not have access to primary care and how public policy decisions can make that better or worse. And then we will end for the afternoon. So that's the run of show. I want to begin with some thank yous as well. First of all, I want to express incredible gratitude at the very outset to the staff leaders of the PCC. So if you are a staff member of PCC, can you just raise your hand, including all those in the back? Allie, I see you. Raise your hand. Thank you very much in advance for what you have done. We are doing some big stuff today, and we couldn't do it without you for sure. I want to thank everybody who made this day possible. People who sponsored this event, Summit, and certainly who sponsored our awards and awards dinner tonight. Thank you very much. And now, thank you very much to all the sponsors on this slide. And now let me turn the podium over to our president and CEO, Ann Greiner, who I mentioned at the Hill briefing this morning. We are extraordinarily lucky to have a leader who is not only an excellent expert, but also a passionate and charismatic champion for our cause. The combination of those two things is rare, and so we are very, very lucky to have Ann Greiner as our CEO. Ann, come on.
Well, thank you so much, and I feel incredibly fortunate to have Mark as the board chair. And I'd also like to flash the picture of the PCC board up for a moment. We believe that it takes working across diverse stakeholder groups to get bold change. And here are the leaders who are going to help our team and our members get there. So we're really, round of applause, please, for the board.